Hi, my name is ZNjoku, and I'm a student at High Terra High School in the Medical Science Academy. I did my project on the relationship between educational background and the duration of exclusive breastfeeding under the mentorship of Dr. Zane, a pediatrician at Access Health Clinic, and Dr. Kulkarni, a neonatologist at Texas Children's Hospital and Sugar Land Methodist Hospital. Introduction. So this is background information on the topic. Breastfeeding is a practice that provides many benefits for both the mother and the child. For the child, these benefits include fewer instances of eczema and allergies, a lower risk of diabetes, as well as maintaining healthy baby weight. The American Academy of Pediatrics recommends that infants are breastfed for about the first 6 months of life with exclusive breastfeeding. So what this means is infants should only be given breast milk and nothing else for the first 6 months. The United States Department of Health and Human Services established the Healthy People 2020 initiative to aim to increase rates of breastfeeding initiation, duration, and exclusivity, with a goal of reaching of at least 25% of mothers continuing exclusive breastfeeding at the 6-month mark. So with this initiative, they implemented certain practices such as training in the hospitals to help with mothers initiating breastfeeding, as well as having certain specialists on site to aid with the breastfeeding practices of mothers as well. However, even with the initiative set in place, maintaining this duration of exclusive breastfeeding has proven to be a challenge for many women in the Fort Bend County. The purpose of this project was to highlight the importance of addressing background differences between mothers so we can assess their individual needs and aid in their breastfeeding journey. This is important because breastfeeding is so beneficial for both the mother and the baby, and it is a national health, and it is of national health importance. So for my methodology, how did I conduct this research project? So I first had to create a questionnaire to be given to mothers at the Access Health Clinic in Stafford. The mothers that it was given to had babies of the ages 4 to 13 months. With the questionnaire, there was questions that related back to demographics, as well as questions about pregnancy and the mother's breastfeeding experiences. In order to get a result from the questionnaire, each factor from the demographics was isolated and compared with the responses for the breastfeeding duration to see if there were any patterns. So this here shows some of the sample questions that were given on the questionnaire. So for demographics, things that were asked related back to age, education, income, marital status, employment status, and if they had any other previous children or not. And then for the questions about breastfeeding, there were open-ended questions, yes or no questions, and questions on a scale. And all of those answers were taken into consideration in order to help with this research project. So for my inclusion criteria, one thing that was important to make note of when choosing participants for this survey was that all the mothers had to be mothers of babies of healthy full-term infants. Full-term meaning the babies were in the belly for over 37 weeks. The reason behind this is babies that are preterm or born before the 37-week mark have different nutritional needs from full-term babies. So they would have to be introduced to baby formula or other dietary supplements earlier in life in order to reach their nutritional needs. And this would create inconsistencies with the data. So it was better just to not use them in the research. So here are the results from the questionnaire that was given. As you can see here, as you go down towards higher levels of education, the data starts to be skewed over to the right to reaching higher levels of breastfeeding duration. And there is one outlier in the data. As you can see, for the less than high school diploma row, there was one mother that did not have any type of degree, but she was able to reach 8+ months of exclusive breastfeeding. And the reason behind this is that she had previous children, so that aided in her breastfeeding journey. So I believe this outlier does show the importance of other background information that can have an effect on breastfeeding rates. And in this table, it shows the same information in percentage form. So as you can see, as you go down towards higher levels of education, again, there is a greater increase in the percentage of mothers that are able to maintain that exclusive breastfeeding. And in this table, the same information is shown. So for my results analysis, 87% of mothers without a college degree did not reach the recommended 6-month mark of exclusive breastfeeding, whereas only 33% of mothers with a college degree did not reach the recommended 6-month mark of exclusive breastfeeding. When compared to the Healthy People 2020 goal of 25%, the mothers without a college degree did not reach this goal at a very great difference to the mothers with a college degree. As you can see, 67% of mothers with a college degree were able to maintain exclusive breastfeeding for 6 months, whereas only 13% of mothers without a college degree were able to maintain exclusive breastfeeding for 6 months. So for my conclusion, for my findings, I did see that there was some type of relationship between education and breastfeeding duration. And the relationship was longer durations of exclusive breastfeeding is correlated to higher levels of completed education for mothers in the Fort Bend County. And it's important to highlight this is only for mothers in the Fort Bend County, as that's where the participants of the survey were from. What this shows is that even with the current initiative in place, there are still aspects that affect breastfeeding rates, and more attention should be given to mothers that come from non-traditional backgrounds to help achieve our national objective. So for greater implications, while I was conducting this survey, many mothers with a smaller educational background commented on not believing their baby was getting enough with just breastfeeding alone, so that is why they turned to formula at an earlier age than recommended. And I believe this concern for a baby's nutritional health shows they were not properly educated on the benefits and efficiency of breastfeeding by their hospitals. Hospitals do have practices and specialists in place to help with breastfeeding, but I believe they're doing a great job with initiation, as there are high rates of mothers starting breastfeeding due to the hospital's help, but the problem lies with duration, as I believe the training given is not given in a way for them to really understand why this is so important. So the solution I propose for this is hospitals should provide training and training books at simpler terminology so it can be understood by mothers that come from different educational backgrounds. They should be given that option to choose what type of material they have that is most comfortable for them. And I believe as healthcare workers, it's their job to bridge those educational gaps in order to provide the best healthcare possible for all the patients. And there are certain things that we can do on our end to help with that. I would like to thank Dr. Zane, the pediatrician at Access Health Clinic, as well as her medical assistants for helping me with this journey. And I also like to thank Dr. Kulkarni, the neonatologist at Texas Children's and Methodist Sugar Land Hospital as well. They gave me a really great mentorship experience, and I was able to learn a lot. So I'm glad they took me under their wings and helped me throughout all of this. I'd also like to thank Dr. Timmer, the lactation specialist at Methodist Sugar Land Hospital, for all of her help. And of course, I'd like to thank Miss Nancy Bryant, the GT Mentorship Coordinator. Here are my research references that I used in order to conduct this research. And that is all for my presentation. Thank you so much.